Hi, my name is Philip. I'm one of the lecturers at 9.09er. In this video, we would be continuing our comparison of the IELTS and the OET, this time in terms of the speaking subtest. Specifically, we would be comparing them in terms of two things. First, test format, and second, the criteria that examiners use in order to know what marks to award. So regarding test format, as you can imagine, because the IELTS is a general English test and the OET is a healthcare focused test, then the experience of candidates in terms of speaking would be very, very different indeed. For the IELTS, for example, the speaking has three parts. The first part is where the examiner asks personal questions of the candidate, like do you work or are you a student, things like that. Topics that are very familiar to everyone. The second part is the individual long term, where candidates are expected to give a short speech. They're given a task card that has the topic and some suggestions of what to say, and they have 1 minute to prepare and to read and to take down notes. And then they're supposed to talk for 1 to 2 minutes regarding this topic. At the end of the 2 minutes, the examiner cuts the candidate and asks one or two rounding off questions. The third part is the extended follow-up. It lasts 4 to 5 minutes, and this is where the examiner asks questions regarding the topic, but of a more general nature. It's no longer regarding the specifics of what the candidate said in the individual long term, but rather it's about applying the topic to people in general. So hopefully you could see that these three parts are an increasing level of difficulty, from familiar topics to less familiar topics. Now, the OET exam is very, very different. In the OET, the speaking exam takes the form of role plays, in which the healthcare professional is speaking to a layperson, either a patient or a relative of the patient. And there are two role plays, role play 1 and role play 2. In each role play, the candidate is given a role play card, which presents information regarding the situation, where it's happening, and what is supposed to occur during the conversation. During this 3 minutes of preparation, the candidate can write on the role play card, take down notes, etc. And after this 3 minutes, they have 5 minutes to perform and to go through the conversation. And then immediately afterwards, no breaks, role play 2 happens. And then 3 minutes again to prepare, and then 5 minutes of performance time. Now, these two role plays have nothing to do with one another. For example, role play 1 is about a grandmother who is nervous for an upcoming colonoscopy, whereas maybe role play 2 is about a teenager who is confused regarding her diabetes medication. In every role play, in every test date, there are a variety of role plays that are being used. Just like in the IELTS, I imagine there are different cards and questions that are being used as well. This is to help ensure test security, that candidates, after they take their exam, wouldn't be sharing what happened to them to other candidates who have not yet taken their speaking test. At the same time, the one thing to remember about the OET is that the speaking test for OET is profession specific. Unlike in the IELTS, where the experience is exactly the same for people taking general training versus academic, in OET, if you're a nurse, you get nurse situations. If you're a pharmacist, you get pharmacist situations, etc. Because speaking is a productive skill, and candidates are expected to use vocabulary in a particular healthcare context. For example, dentists are supposed to be talking about teeth in their work, not animals, but vets are supposed to talk about animals in their work, not so much about teeth. So in that sense, this is very reassuring that the kinds of words and ideas and situations that candidates are expected to talk about and would encounter would typically be the ones that they are already familiar with as members of their profession. Now, here's an example of the part 1 of the IELTS speaking, introduction and interview. Let's talk about your hometown or village. What kind of place is it? What's the most interesting part of your town or village? Let's move on to talk about accommodation. Tell me what kind of accommodation you live in. How long have you lived there? What do you like about living there? As you can see, these are very general, everyday, relatable questions meant to get the candidate talking about these familiar subjects. This is an example of an individual long term, a task card for the individual long term. Describe something you own, which is very important to you. You should say where you got it from, how long you have had it, what you use it for, and explain why it is important to you. You will have to talk about the topic for 1 to 2 minutes. You will have 1 minute to think about what you're going to say. You can make some notes to help you if you wish. The examiner would be asking 1 or 2 of these round-off questions after the candidate has finished talking. Is it valuable in terms of money? Would it be easy to replace? Here's an example of the questions that examiners ask for part 3, for the two-way discussion. Let's consider first of all, how people's values have changed. What kinds of things give status to people in your country? Have things changed since your parents' time? Finally, let's talk about the role of advertising. Do you think advertising influences what people buy? So you see, this is still a discussion about things, but no longer about the specifics of the candidate, of what the candidate said in the individual long term, but rather the conversation has moved to a discussion of it in general for people, in this case, in the country. So it is truly, in that sense, an increasing level of difficulty. This is an example, on the other hand, of the task card that is given for OET Speaking, the role play card that's given to them. You would notice that 3 things are given: the setting, where it's happening. In this case, it's a home visit. The second would be the situation. You are making a home visit to a patient who is suffering from chronic obstructive pulmonary disease, COPD, and requires continuous oxygen. Mobility is now a problem. The patient's spouse has been caring for him or her at home for 2 years, but has recently returned to work. You have just completed an assessment of the patient's needs and are discussing full-time care options with his or her spouse. The patient is not present for the discussion. So this is information that the healthcare professional and the candidate already knows. And the tasks that follow, we see here 1, 2, 3, 4, 5. These tasks are the things that he's supposed to talk about, as well as the sequence which he's supposed to talk about it. Find out how the spouse has been managing since your last visit, reassure the spouse about the situation, outline options, explain benefits, advise on choosing nursing homes. So you see, unlike the IELTS test, which is very general, applicable for everyone, the OET speaking test is quite specific, assuming that candidates are familiar with these kinds of situations already. Now let's talk about the criteria for scoring. Because the IELTS is a general English test, it assesses English in general, fluency and coherence, pronunciation, grammatical range and accuracy, and lexical resource. Fluency and coherence is about minimizing, among others, unnecessary pauses. It's about responding to the topic and being understandable in terms of the ideas that are presented. Do the ideas given by the candidates match the questions being asked by the examiner? Pronunciation is about making sure that you use the correct sounds of English. You don't mispronounce, compromising meaning. It's about ensuring that your accent doesn't get in the way of your being understood by the examiner. Grammatical range and accuracy, it's about ensuring your grammar is both correct and complex. If your message is simple, keep the grammar simple. But if your message is complex, you have to make sure that your grammar can keep up in order to express the sophistication and complexity that you want to communicate. Lexical resource is all about vocabulary. It's ensuring that your word use is precise, that when you paraphrase, for example, in order to avoid being repetitive, that the meaning doesn't change, this is not compromised. It's about ensuring that the vocabulary that you use communicates what you want to communicate, among other things. These 4 things are of equal weights, which means that if you're not so good in one area, that doesn't necessarily mean that you would fail, because you could use the other criteria to compensate for this. At the same time, it doesn't mean that if you're good in one area, for example, your vocab is great, that you've already passed. because you still have the other 75% to worry about. In other words, it's a holistic assessment, and they take all of these four things in consideration. Now, unlike the IELTS, the OET, as we mentioned, is a healthcare focused test. And there are certain things in healthcare that are important, speaking, for example, in healthcare, that are important, that are not generally important in other situations. And that's why in the OET, there are two kinds of criteria that examiners use: linguistic and communicative. There are four linguistic criteria: fluency, intelligibility, appropriateness of language, and resources of grammar. Fluency, similar to the IELTS, is about avoiding unnecessary pauses, making sure that the rate of talking is not too slow, etc. Intelligibility is similar to pronunciation, making sure your accent doesn't get in the way of being being understood. Using emphasis, for example, or so that certain things are highlighted, making sure that you're using the correct sounds of English. Appropriateness of language involves your tone of voice. There's a very big difference in delivering bad news to a patient, for example, a cancer diagnosis, versus delivering good news, saying that the patient is cancer free. In addition, the use of vocabulary comes into play as well. Because the audience here is a layperson, and the healthcare professional has to talk about healthcare topics, it's important that healthcare professionals do not resort to the use of unexplained jargon, which would be unintelligible to somebody who doesn't have healthcare training. So appropriateness, that is incorporated in health and appropriateness of language, among other things. Finally, resources of grammar. It talks about the correctness of the grammar that's used, similar to grammatical range and accuracy. Sentence forms, complex compound sentences, the use of tenses, the use of conjunctions, prepositional phrases, the whole shebang. Again, if the message that needs to be communicated is simple, it's important to keep the grammar simple. But if the message that needs to be communicated is a little bit more complex, then the language has to be able to keep up, to communicate the complexity of the message. So you see quite a lot of overlap between these four criteria, between the IELTS and the OET. The communicative criteria, though, these are things that are specifically important in healthcare, and there are 5 of them, each of equal weight, 3 points each: providing structure, building relationship, incorporating the patient's views, gathering information, and giving information. Providing structure, because healthcare professionals need to explain lots of complicated things, and it would be important to scaffold, to present structures to help laypersons understand these complicated issues better. For example, by providing outlines before giving complex instructions. For example, ma'am, there are 3 stages to blood transfusion. So before talking about these stages, one can signpost and inform the layperson ahead of time that there would be 3 things that they would need to keep in mind and can expect. Building relationship is about, among other things, providing empathy. If the layperson would be expressing an emotion, for example, anger or hostility or sadness, etc., then this is not ignored by the candidate, but rather these emotions need to be validated and recognized, making connection, building rapport, which is something that needs to be done all the time when it comes to healthcare. Incorporating the patient's views means that the healthcare professional, the candidate, shouldn't just be vomiting information with no regard for how the patient views it, but rather the input that a healthcare professional provides needs to incorporate what the patient thinks. Has to be customized to the patient's unique circumstances. So avoiding giving generic instructions or generic interventions entails paying very close attention to what the layperson is saying in order to calibrate one's response. That would help the layperson in his unique circumstances the best. Gathering information is something that healthcare professionals need to do all the time. Asking questions appropriately, such as beginning with open-ended questions before proceeding to closed-ended questions, such as doing active listening, so that because if people are reassured that the healthcare professional is paying strict attention to what they're saying, they feel valued and they are encouraged to give even more information. Things like this. And finally, giving information, structuring ideas when giving instructions, for example, ensuring that after instructions are given, the layperson actually understands what was said. In giving instructions through chunking, one at a time, having appropriate pauses between important parts to give the layperson time to digest the information, to absorb what was said, so that they do not be so that they don't become overwhelmed with everything that's said. So you see very, very different criteria for the IELTS versus the OET. Now, one important thing to keep in mind is that in the IELTS exam, the person that the candidate is speaking with is the examiner, the one giving the grade. On the other hand, in OET, the one that the candidate is speaking to is called the interlocutor, not the examiner. The interlocutor merely facilitates the exam. The examiner, based in Melbourne, doesn't see the candidate. They only get the audio recording of the role plays. So in this sense, it's good, of course, for the examiner to focus to only have the audio, because this focuses on the English. On the other hand, in the IELTS exam, it's by because the examiner sees the candidate, it more closely reflects what happens in the real world. So there are reasons for both of these things, and the criteria are different in that sense. And it's important for candidates to know what the examiners are looking for, so that they would have an easier time to give it to them. Hopefully, this overview of the OET and IELTS speaking test is helpful to help you make a more informed choice on which of these exams is a better fit for you.